Premier is breaking another promise, this time to Alberta seniors. As a PC leadership candidate, in a letter dated September 6, 2011, this Premier assured seniors she would cancel the proposed Alberta drug strategy and retain the current program. Now, as Premier, she's looking to replace the current plan with an income-adjusted plan that could see seniors paying hundreds or even thousands more for their prescriptions. To the Premier, why have you broken another promise, this time to our most vulnerable citizens?
Honourable Leader.
Mr. Speaker, first of all, the comments made with respect to ASDS were important, Mr. Speaker, because we wanted to make sure that we were putting in place a system that did take care of the most vulnerable Albertans. And, Mr. Speaker, the work that our Minister of Health is doing on Pharmacare is ensure that that is exactly what will happen. This program, Mr. Speaker, will ensure access for 20% of Albertans that currently do not have drug coverage, Mr. Speaker. The work that he's doing with respect to generic drugs, Mr. Speaker, is going to ensure that the price of medication goes down. Everything we're doing is about ensuring that medication is more accessible for everyone in this province, Mr. Speaker.
Honourable Leader, second question.
Thank you very much, Mr. Speaker. In this Premier's letter, she clearly stated that income-based supports for prescriptions are, quote, a poor repayment for seniors' contributions to building Alberta. Just before the election, the Health Minister underlined the commitment to seniors, saying government has no intention to make changes to the plan. But that was before the election, and this is after. To the Premier, why didn't you tell Alberta seniors the truth?
Honourable Leader.
What we told Alberta seniors and all Albertans is that we wanted to ensure that we had a Pharmacare system and a drug system that ensured that the most vulnerable people were protected, Mr. Speaker. And as we move forward, that's exactly what we have. We saw the opportunity in the past 12 months to do something better than what we'd actually thought was in place before, Mr. Speaker. We're committed to doing that, not only to serve Albertans and Alberta taxpayers, but also to ensure that we're allowing our healthcare system to continue to be sustainable, and we're committed to that, Mr. Speaker.
Before the last election, this Premier made so many promises to so many people they could fill the Saddle Dome. Clearly, this Premier will say anything to anyone in order to get elected. Now, she's tricked vulnerable seniors into voting for her by making promises she had no intention of keeping. Premier, have you no shame?
Mr. Speaker, this is a government that wants to ensure and has ensured with this budget that we are protecting vulnerable Albertans across the board, Mr. Speaker, whether they are seniors, Mr. Speaker, or otherwise. And I'll talk about some promises we made that we kept. We promised to protect vulnerable Albertans, to hold the line on spending, to not increase taxes, to improve Pharmacare, to fund insulin pumps, to build family care clinics, to build new schools, to fast-track emergency rooms, and renew our fiscal policy framework. And, Mr. Speaker, we made those commitments and we kept those commitments.